Hey everyone. So, last week we really tried to ease into the material and start to think about grief and loss as really normal parts of life and things that losses that occur really throughout the lifespan in a lot of different ways. This week we're really diving into what are the impacts when we lose something or someone. And of course we are actually doing reading this week from Worden. This is me looking for my book. Here it is. And the chapter is uploaded in Canvas. But again, this chapter has a couple things that we're going to revisit at other times, such as we're not going to talk a lot about Lindemann today. We're going to be talking about that, I believe, next week. We'll also touch a little bit on Bowlby today, but again, we'll do that more next week. What we really want to look at is what are the common emotional responses to loss? What are the physiological responses to loss? What are behavioral responses to loss? There are so many of them, and people can experience multiple different responses to loss and grief. They can experience them in different orders, in different ways. So we're just going to look at that today. So again, we're going to start out with just a brief conversation around John Bowlby. Now, John Bowlby is famous for being the author of attachment theory, which is a theory that I actually find really useful in counseling. It is about the fact that humans need attachment. We need to feel secure with others. We get a sense of emotional safety of feeling attached to others. But, I would say when it comes to grief, that also I think can include, the ways that we feel secure within ourselves, an internal sense of safety. And so when we talk about also, again, losses beyond death, like losing a home or losing a job, being victimized in some way and losing that sense of safety. We also need to attach to ourselves and feel comfortable attaching to the world. So attachment is this important human need, and when our sense of attachment to something or someone is broken, there can be a very strong emotional response because, again, the things and the people that we attach to tend to really inform our identity, our sense of reality, of what is real, of what is important, influences our values. So the more attached we are to something, the greater the sense of a bond. And again, in the book, it really talks about bond to a person, but I think we can map that concept of what we're attached to and bonded to beyond even people. The greater that bond, the greater the loss response. There can be a sense of wanting to cling for what was lost, a sense of sadness, crying. We can also feel angry. There are a lot more emotions in that, but those were emotions that Bowlby himself pointed out that he noticed when individuals lost something or someone they were attached to. It's also important to note that this sense of attachment, particularly social attachment, is also very noticeable within the animal world. So this is something, and humans are also animals, I always like to remember and remind students. But I couldn't put up a photo of like a dolphin carrying around her dead baby because that seemed a little too much too soon. But there are a lot of examples when animals will lose young or lose family members. They will stay with the body. They will carry the body around. But here's a picture from the National Wildlife Federation. They did an article on when animals grieve. And these are some baboons that are grooming each other more often than usual after the death of a companion. So animals will experience loss, they'll experience grief, and they will also experience an increase of certain coping behaviors to lower the stress hormone levels that come with grief and loss because a lot of stress is released in the body after a loss. I also liked this quote from Dr. Colin Murray Parks. Actually, Queen Elizabeth is often credited as saying part of this. But it says, "The pain of grief is just as much part of life as the joy of love. It is perhaps the price we pay for love, the cost of commitment. To ignore this fact, or to pretend that it is not so, is to put on emotional blinkers, which leave us unprepared for the losses that will inevitably occur in our own lives, and unprepared to help others cope with losses in theirs." So some people conceptualize grief as the cost that we pay for love, and of course that can mean loving other people, but I think that can also mean loving ourselves, loving our homes, loving our world that we've built, loving our jobs. And it is that desire to love the things around us that when they're taken from them, that grief is often this price. So we can already see that grief is a powerful experience connected to powerful things in our lives. And one question that we're going to continue to explore in this class is if grief is such a powerful, often negative experience, is it bad? Is it a disease? We're going to look at different symptoms of grief, and grief can significantly impact emotional, cognitive, physiological, social, and functional well-being. It's a natural part of life, but it's intense. It can be really extreme. We want to ask ourselves, when we lose something, are we supposed to heal from that? And what should that look like? I want you to start thinking about that. What role does healing have in the grief process? Are we expected to be okay eventually? Are we expected to be the same? I think I always hope for my clients that they would, find more peace and have feel less tossed about by the strong emotions of their grief. But I personally struggle with that question of when is grief not okay and when is it normal. But as we'll look at, grief can often lead to depression. There are times that people do need help, but also I think they have to choose that for themselves. So I'm always hesitant to tell someone that they're diseased or their grief reaction is bad, but if it's hurting them and they're willing to ask for help, I certainly want to help them find some relief, because grief experiences can be crushing. Worden also sort of talks about different, there is an expectation among most psychologists, psychiatrists, counselors, social workers that as people are grieving, they should be kind of growing, they should be getting better at some point. But again, I think that's not a tidy timeline and can be very messy. But she talks about some people say that you have to recover from loss or restore, find restoration after loss. And she prefers the term adaptation. So semantics, this question, why are semantics so important? You will find that people who are writing about grief or talking about grief, they struggle with this tension of, is grief a disease? And so if it's disease, is it something to recover from? Can we recover from it? Other people try to have more of a lens like Worden of, you can adapt to the loss. You can find a new normal. So while healing can be possible and hopefully is possible in the grief process, it's not the same as recovering from an injury, because you might never be the same, and that's okay. So grief, it's not a disorder, it's not a disease, it's not a sign of weakness, it's an emotional, physical, and spiritual necessity, the price you pay for love. The only cure for grief is to grieve. Earl Groman. Another thing I want to point out are some difference in terminology. So again, this chapter is very much based around death experiences. In this class, we're trying to look beyond just death experiences, but of course death experiences are very important. If you see the term mourning in this book and the other book, really in general grief literature, it refers to the process that one goes through in adapting to the death of a person. But I always think, what would we call that for non-death losses? The loss of a relationship. Can you mourn the loss of a relationship? I think so, etc. So again, the language is often normed around death, but I think, again, how can we think of it beyond just that? Bereavement is also considered the period after a loss during one which is mourning, and again, bereavement tends to mean death. So I will use that term bereavement when I'm talking about a grief experience that's tied to death. If not, I may use the more general term grief and loss, but they are used often interchangeably. So, what are common emotional responses to grief and loss? Now, we have people in different stages of their career and academic journey in this class, but emotions are automatic, very important parts of being alive. They're not always consciously registered. Feelings can have a huge impact on our thinking, on our physical feelings as well. But there is just a myriad of emotions that people will experience when faced with a loss. So the first that we think of is sadness, right? This often can include crying, but doesn't have to. Also, there can be a lot of kind of cultural messages against sadness, and people can feel particularly vulnerable when they feel sad, whereas opposed to anger, that can feel like more of a powerful emotion. People can feel really ashamed of feeling sad and feel like they need to hide it because they feel too vulnerable. So some people really try to stuff sad reactions, and a lot of grief professionals try to encourage people to express them, seeing that as important to the grief process. But sadness is often there, and people sometimes feel ashamed of that emotion. Anger can be really common. People can feel angry at a lot of things. If they lost a person, they can feel angry at the person they lost. There are different reasons why that might seem more rational or not rational, but regardless. They can feel, some people feel angry that someone got cancer and died when they couldn't do anything about that. Some people might feel angry that a loved one was drinking and driving and then caused a loss of life. People can also feel angry at factors that contributed to the loss. So again, they could feel angry at the disease. They can be angry that when someone else causes a death, it can be common to feel angry at that person who caused the death in an accident, or definitely in the situation of like a crime or a murder. But you can also feel, angry at, say you lose your job, you could feel really angry at the people who might have facilitated you losing your job, or the people who were in control of that. If you lose your home, you could feel angry at the bank who refused to work with you or created loan conditions that were impossible for you and your family to afford. So anger definitely plays a role in loss experiences, because sometimes someone really has taken something from you. Sometimes it's unavoidable, but regardless, anger can still show up. Frustration with lack of control can be a common theme that can be connected to that anger. We often want to control things. Control can be a very soothing experience to feel like we're in control, and loss usually involves a loss of control, because if we could control it, that loss wouldn't have happened. Some people can also feel anger related to feeling helpless. Again, that something happened and we couldn't control it and I feel helpless. And instead of turning to sadness in that helplessness, some people feel angry about it. Blame is also a very common emotional experience. Can be connected to anger, but can also be about, trying to find an answer. Like if I can blame something, I think there can be this like emotional or cognitive belief that it'll all make sense. But like grief and loss often doesn't make sense. So there can be a desire to blame, to find who's responsible, what's responsible. People can blame the person they lost, as we talked about before, but a lot of people blame themselves in the face of loss. And that self-blame can really escalate into feelings of guilt or self-reproach, thinking, if I had done better, this loss wouldn't have happened. If I had been better at my job, this wouldn't have happened. If I hadn't worn, there could be cultural messages. If I hadn't dressed that way or acted that way, that person wouldn't have abused me. If I had been kinder to that person, or if I'd taken better care of that person, they wouldn't have died. So it can be a very slippery slope in a common experience. Anxiety, that can range from light experiences of anxiety to panic. Different sources of anxiety, of course, fears of being able to handle life tasks after the loss. I've lost my job. How will I pay for things? I've lost this person. How will I take care of myself? Also fears of factors that led to the loss. So if there was a disease, if there was an accident, if there's a loss of relationship because of relational behaviors. Maybe you don't know why you were dating someone, it was a meaningful relationship and it fell apart, and you're grieving that and you can't pinpoint it. You could feel overwhelmingly anxious about dating other people or, marrying someone else again. So you can start to focus on trying to figure out where are those things that went wrong and how can I avoid them. And clinical anxiety can develop, so these feelings of anxiety, they can become a pattern and turn into what some might diagnose as an anxiety disorder. That can also include things like PTSD if a trauma was involved in the loss. Again, violence can create loss experiences and can also be traumatic, or a natural disaster taking out your home can create feelings of trauma, lead to PTSD, as well as phobias. So, someone who lost someone to a disease may become overly phobic of being outside, of risking injury or accident, so may become reclusive. Loneliness is a common feeling, and that is a common feeling expressed by bereavement survivors. But I also think that when there's a loss experience, and if it's happened to you, you can just feel very isolated, and like other people won't be able to understand the weight of what you're experiencing, the pain. I know someone wrote on the discussion board about knowing a teenage female who lost a baby, and everyone was just kind of happy for her because they didn't want her to be a young mother, but she was experiencing this profound sense of loss. Thank you for the person that shared that. That's a kind of loneliness of just feeling alone. And, disenfranchised grief, I think that can bring feelings of loneliness. Fatigue, we can feel apathetic, listless, not find pleasure in things that we used to enjoy after we've experienced a loss. But that can feel surprising and distressing to individuals, but they're just overwhelmed. They just don't have the energy to care about other things. But it can also make it harder to complete required tasks. So you think about If you lost a job and you need to get back out there, if you've lost your home and you need to find another home, if you've lost a loved one and you have to arrange a funeral, it's a very stressful time and then feel very fatigued because you often have other tasks to do. Confusion, and in the chapter they put this under a cognitive impact, but tomato, honestly. Confusion is a very powerful feeling, and I think that is extremely common in loss experiences because, again, people often want to make sense of loss experiences, but there often aren't answers. Sometimes there are, right? But sometimes there aren't, and even if you could get that answer, it doesn't always take away the sting of what's happened. So I'm definitely one of those people. I always want to make sense of things, and I've had to learn to tell myself, even if I can make sense of this, isn't not going to change how I feel right now, right? Shock. Shock can be a very intense feeling, often a facet with dealing with a sudden death, but this applies to a myriad of loss experiences. So again, usually if there's a loss that was not expected, not foreseen, you can just feel really stunned. There can be a strong sense of disbelief or feel as if reality doesn't make sense anymore, isn't real. There can be a sense of depersonalization of, am I real? Like, what is real anymore? There can be a strong dissociation from reality. Connected to that is a sense of numbness. When you're in shock, there's often a feeling of numbness there, of just like not even knowing, being very overwhelmed. But people can also experience numbness where, this is like the person going to a funeral and they don't appear to be crying. They just look like it's a normal day. There's not a lot going on their face. People often will be judgmental of that response and think, that person doesn't care. But, that's really a protective mechanism. Sometimes our brain makes decisions for us. Isn't that bizarre? We might not consciously be aware, but some part of our brain might decide, like, this person cannot handle all the feelings that they that they need to experience right now. It's too much, so let's just numb them out. So again, it's considered kind of a protective response to that wave of feelings. And it's not unhealthy, per se, to experience numbness for a while when faced with a loss, unless an individual never progresses towards other feelings. Again, we're making the distinction of when is grief unhealthy or healthy, but it is considered if someone forever kind of remains numb to that loss, there are probably things that they need to experience and feel and things that they're ignoring. But any experience of numbness is not a sign that something is wrong. It can actually be quite normal. Yearning for what was lost can also be very common, and obviously that's easy to think about with other people, but missing the comfort of familiarity, missing again, the job I used to have, the home I used to have, the relationship I used to have, the physical abilities I used to have that I don't have anymore, the, safe world I used to have. And what I also want to just briefly discuss is that, some loss reactions are actually positive. That doesn't mean that, usually if there's a loss experience, there are going to be negative emotions, but there can be positive feelings mixed in. Losses can bring a sense of relief, even if relief isn't the only feeling. And so a sense of relief can be really common at the death of someone with whom you've had a difficult or painful relationship, right? Maybe it wasn't always easy, and while you miss some things, you might also feel a relief that you don't have to constantly navigate this complicated relationship. Also things like leaving a relationship, right? When you break up with someone and there's divorce or some kind of loss of a friendship, painful job experiences, leaving a home that was painful, etc. If you are forced out of your home because your parents don't agree with your sexual orientation or gender expression, that can be a painful feeling to lose parents, and you want to be loved by them, but it can also be a relief to not feel like you're being judged all the time or like you can't be yourself. Guilt can also be common when there are feelings of relief after a loss, especially a death. But, that sense of relief can be mixed with guilt. And emancipation is another one mentioned. I think that I could kind of consider that like a step up from relief. That's a sense of, I'm finally free. And that's kind of a deeper sense of relief. And that can really come along with the loss of a person or people that felt hostile, abusive, negative. So certainly if you were growing up in a home and there was a lot of physical, emotional, mental violence and not really a lot of positive attachment, if it really was a negative experience, there can often be a sense of huge relief at being free from that, or losing someone that was very abusive towards you. It can be normal to feel just relief and mostly good about it. And that makes sense. I'm always interested in also the link between, physical and emotional experiences, and there are a ton of physical sensations that follow grief and loss. And hollowness in the stomach, tightness in the chest, which is a very scary kind of anxious feeling, tightness in the throat, sensitivity to noise, as I mentioned before, a sense of depersonalization, almost feeling not physically present and connected to reality, breathlessness, weakness in the muscles, lack of energy, and looking at these photos, you think of feeling fatigued, sleepy all the time. That's a physical sensation. And I think when people are really experiencing emotional pain, it's common for people to just do this grabbing in their heart, like there's a tightness in my chest and I need to really feel it here. That is a very common kind of loss, wounded, hurting move. And I posted a video that actually breaks down a little bit more around what are some of the chemicals that are released in our brain when we're experiencing the emotional reactions to loss, and how do some of those chemicals also impact different physical bodily functions that we have. And I think that, loss of appetite is here, okay. And connected behavioral responses, so these can be connected to both the physical impacts and the emotional impacts. Sleep disturbances, so, individuals can find it really difficult to fall asleep. One person I was talking to recently that had lost a parent discussed, finding it difficult to sleep where they used to sleep because it reminded them of caring for that parent, so they were sleeping on the couch. Some people might have trouble falling asleep, that might be overwhelmed with thoughts and feelings related to the loss. Some people also can sleep too much and feel like they just want to disconnect and sleep all the time. They can also wake up suddenly with strong emotions, wake up after a difficult dream related to the loss. There can also be severe eating disturbances. As we remember, there can be a feeling of hollowness in the stomach. Grieving individuals can overeat or undereat, but it's more common for people to report that they just don't have an appetite. And of course, we need sleep and food to maintain every type of well-being. So these are really intense kind of impacts and can really just disrupt someone's day-to-day ability to just function. Social withdrawal, you can want to be alone in your emotions. But at the same time, that can also coexist with feelings of loneliness. We can want to be loved and also feel like we need to be alone at the same time. Also, people can withdraw because they don't feel supported by their community. They can be unsure of how to present, if, the example of the man who came back to work after he and his wife lost a baby, and all of his coworkers were being really weird about it and didn't know what to say, and so then he felt like he had to stuff his feelings down and then take care of them. It makes sense that in those cases people want to withdraw. That was something that counseling cancer patients would talk about a lot. They just got tired of people trying to make them feel positive about the fact that they had cancer, and they just wanted to be alone and feel like crap because they did. And that can be a very normal and okay thing. People can also seek out reminders of what was lost and also want to avoid reminders of what was lost, and that can exist for the same people and be different at different times. So some people want to avoid places, people, and activities connected to the loss. For other people, it can be really important to keep reminders, so keeping sacred objects, keeping photos, visiting places, engaging activities that are connected to what was lost. And so as I was reading and thinking about this lecture, I was thinking about the song Always Something There to Remind Me by Naked Eyes. I think it's a cover, but it came out in the 80s, and it's about this loss of a relationship, and they're going around and they're just saying, there's always something there to remind me. The coffee shop we used to go to, the song we used to listen to together, and it's really a song about this loss of a relationship and their grieving. So your discussion board post, one of your posts that I want is talk about a song, or it can be a picture, an image, a painting, something that represents these reactions to grief, a feeling about grief, a thought about grief, a physical response to grief. And also in your pop culture analysis paper, these are the things I really want you to pull out. What are the emotions they were experiencing, the cognitions, the behavioral responses, the physiological responses to loss. So those are those symptoms, those impacts of loss that we're looking for. So yeah, discussion board, give me a song, give me a painting, give me a photo, something, a little thing like that of your choice that talks about an experience of loss and like the symptoms, the particular symptoms of loss. So always something there to remind me as someone who is trying to seek out reminders of that loss of relationship. So we just talked about all these things, and again, there can be so many, am I here? I can't tell. There can be so many different symptoms to experiencing loss, and they can happen at different times. They're very impactful. They can be very exhausting. They can be very confusing. It can feel like being in a maze, and you don't really know what's going to come next when you turn the corner. I also think of like Alice falling down the rabbit hole, and it seems like time is spent, and there are all these different experiences and objects that she's not used to. You can feel like a fish out of water when you're experiencing loss, because everything seems new. A lot of things can feel negative and scary. There can be moments of positive in there as well, but it's complicated, right? So again, going back to that question, if loss and grief can be such powerful negative experiences, when are they something that would require treatment or support or help? As I said before, I'm hesitant to tell people like your grief is really unhealthy. I've had to do that at times, but I tend to make sure I really know that person well and I really understand what I'm talking about. But grief can turn into some negative things, and people can need help. But again, I think they have to want that help. But the book talks about grief and depression, and there's an interesting relationship there between grief and depression. Grief can lead to depression, absolutely, and I think that's something that anyone in a helping field needs to be aware of. It can also mimic depression and be misunderstood as depression. And so to break that down, let's look at this table that includes some of the DSM-5 criteria for major depressive disorder. Now, there's been a lot of chaotic conflict about how grief should show up in the DSM-5, which is the Mental Health Diagnostic Manual, over the years. And the DSM-5, I think, did a decent job at that. There is no grief diagnosis. There used to be a bereavement exclusion that said, if someone has had a loss in the last 2 months, you can't diagnose them with depression. But sometimes people actually do go beyond what we consider normal grief into depression, and sometimes they need help even within 2 months. So it's not about putting a time frame on grief or calling grief a negative thing or an abnormal thing, but sometimes it can grow into more powerful experiences. So these are the symptoms of depression: depressed mood, loss of interest or pleasure, usually in activities or things that you used to enjoy, change in weight or appetite, insomnia, so not sleeping at all, or hypersomnia, sleeping way too much, psychomotor retardation or agitation. There can be, difficulty moving, feeling fatigued, feeling exhausted, loss of energy or fatigue, feeling worthlessness or guilt, impaired concentration or indecisiveness, thoughts of death or suicidal ideation or suicide attempt. And then, of course, they have some of the symptoms of depression for children and adolescents. If you look at those symptoms, there's a lot of overlap with the common responses to loss, right? So when do you know that grief has moved on to depression, and depression can have really powerful impacts on the brain and on personal well-being? So this is a table from Cavan and Barone, grief and major depression. There we go. Sorry, it's bothering me. Which I think is helpful. So, and again, this is also normed on bereavement, not other types of losses. We have a lot more work to do in describing the emotional and mental health importance of losses that aren't related to death. So, whereas in depression, it's common for people to have negative emotions. When there's a loss, it makes sense that there's going to be negative emotions, and there can be waves of that pain. But again, it's supposed to be thought of as waves. They come in and they go out. Whereas with depression, it's kind of more constant, consistent all the time. Usually with grief, there's at some point, moving to another emotion or some amount of relief or distraction for a while. In depression, there can be a pervasive depressed mood and inability to enjoy things. You can't be happy. You don't enjoy their activities, people, food, etc. Again, there can be an emptiness and loss accompanied by, again, that occasional pleasant emotion. So you can feel very, I'm not hungry, I don't want to go out, I don't enjoy things, but But with grief, we hope that over time that starts to shift. Self-esteem, people can be very blaming of themselves during grief, but usually there's some amount of self-esteem preserved. However, if there are derogatory thoughts, they usually involve failing in relationships to the deceased, or feeling like you failed and that led to your job loss or your home loss, etc. With major depression, that self-criticism just tends to be turned up a notch, and again, it's more pervasive. Sociability, might want to be alone, but can go out and be with other people, whereas depression, it is more consistent. And so that's really the theme throughout, that with grief, these painful feelings come in waves. They're usually intermixed with positive memories of the deceased or what was lost, but again, that might not apply to all loss experiences, but it shouldn't be this overwhelming negative feeling all the time, though that is definitely present. And usually the sense of self-esteem is somewhat maintained, whereas depression, the mood is consistently low. And that is considered for at least 2 weeks nonstop. So if someone is feeling really low 2 weeks nonstop, it could be depression. But again, when do we really want to make that call, especially if that loss was pretty recent? One thing is if there's suicidal ideation. That is when most professionals will say, even if there was a loss, within just 3 weeks ago, and we're mimicking a lot of depressive symptoms here, if someone is feeling suicidal, usually that is considered more depression, and that has to be addressed. But again, there's a lot of problems with medical professionals mistaking grief for depression, and so something I experienced a lot when I was working with cancer patients is I would have clients who were grieving, right? But doctors were just instead putting them on Xanax. And for some people, it can be helpful to have medication while you're in the grieving process, but could also stifle some emotional experiences that you need to experience to get through that grief process. So it's really tricky. We don't want to assume that all grief is depression, but we also know it can turn into depression, and we should be able to offer help to people and relief if that's the case. And, as a counselor, I'm here to help people find relief and make meaning of their experiences, even if it's just grief, because grief in itself can be painful. But again, I just think these are interesting thoughts, especially for those counselors out there, people who are doing diagnosis. It is worth looking up, reading more about grief and depression and the overlap, when we need to understand them as separate things and when they can overlap and complicate one another. And it's usually thought that individuals who their grief grows into depression, that the grief will just be more severe and last longer. But again, sometimes that's okay. There are good reasons to be depressed too. So I have 2 other videos. One is an individual talking about Dr. Zizuk, who's a huge name in grief research, talking about what he considers complicated grief and when he thinks people benefit from treatment when they're experiencing grief. And another one talking about physical sensations and the chemicals that go along with the emotions with grief and how those show up. So you have a discussion board post that I mentioned earlier, and watch those other videos, and then I'll have another prompt on the discussion board. See you guys.